Inside the heart, we have 4 chambers, 2 upper chambers and 2 lower chambers. We name the upper chambers atria and the lower chambers are ventricles. So here we have right atrium, left atrium, right ventricle, left ventricle. Since in the right side of the heart, deoxygenated blood flows and in the left side, oxygenated blood flows, and we do not wish to mix these two blood between the right and left side of the heart, we need to have wall. We refer to the wall that separates the 2 atria, interatrial septum. Inter means between. And the septum that separates the 2 ventricles would be referred to as interventricular septum. What we expect from heart and blood vessels would be we want veins to bring blood into the atria. That's exactly what veins do. They always take blood toward the atria. We have some veins that take deoxygenated blood to the right atrium and some other veins that take oxygenated blood to the left atrium. Then from atria, blood must flow into the ventricles. And as soon as I mention this, that becomes clear that between atria and ventricles, we do not have wall. Instead, we have gates, we have doors. And when the time comes, ventricles pump blood out, and those blood vessels that take blood away from the inside of the ventricles, we refer to them as arteries. So right ventricle pumps deoxygenated blood into an artery, and left ventricle pumps oxygenated blood into another artery, which I'm going to discuss their name later in this video. Let's get back to the gates that we have between atria and ventricles. One important thing about these gates is that they must be unidirectional. It simply means that these gates must allow blood to flow only from atria to ventricles. In those circumstances that ventricular walls contract and push blood up, these gates must quickly close and prevent backflow of blood from ventricles to the atria. We name these unidirectional gates valves, and specifically the valves that we have between atria and ventricles are referred to as atrioventricular valves. So we have 2 atrioventricular valves. One is between right atrium and right ventricle. The other one is between left atrium and left ventricle. The other name that we use for right atrioventricular valve, or in short we can say right AV valve, is tricuspid valve. And the left AV valve is referred to as bicuspid valve or mitral valve. Speaking of veins that bring blood toward the atria, if we focus on the right atrium, 3 veins bring the oxygenated blood to the right atrium. One is superior vena cava, the other one is inferior vena cava, and the third one is a vein that is on the back wall of the heart and is called coronary sinus. In this image, we see the opening of coronary sinus into the right atrium. This is exactly where it releases deoxygenated blood that it collects from the wall of the heart into the right atrium. When we focus on the left atrium, there are 4 pulmonary veins that from lungs bring oxygenated blood into the left atrium. We have basically 2 left pulmonary veins and 2 right pulmonary veins. And speaking of arteries that ventricles pump blood to, right ventricle pumps deoxygenated blood into an artery named pulmonary trunk. However, left ventricle pumps oxygenated blood into another artery named aorta. The beginning of aorta goes up, that's why we refer to the beginning of aorta as ascending aorta. Note that at the beginning of pulmonary trunk and at the beginning of ascending aorta, we have two valves. We name these valves semilunar valves. And specifically, we name the semilunar valve at the beginning of pulmonary trunk pulmonary semilunar valve, and the one at the beginning of ascending aorta is referred to as aortic semilunar valve. Clearly, when we say these are valves, it means that they allow blood to flow only in one direction, from ventricle into the arteries. So, in short, inside the heart, we have 4 chambers and we have 4 valves, 2 atrioventricular valves and 2 semilunar valves.